So today I'm going to be administering the injectable medications for the patient Manny Stickins. The first thing I'm going to do is come to the Pyxis and pull the medications, compare them against the MAR. So the first thing on the order from the verified MAR is we are going to be administering Practi-Amp 1.7 milliliters. So the first thing I'm going to do is I'm going to get out my ampule of Practi-Amp. This is a 2 milliliter tube, 2 milliliter ampule. It expires February of 2029, so it is good to go. 2 milliliters, expires. Next up, we are administering 8 units of insulin R subcutaneously for the 0900 administration. This is for the 0900 administration. So we have our insulin R. This vial has 10 milliliters, and since we only need 8 units, I'm not going to drop it and create bubbles. And this expires in February of 2029. Insulin R, 10 milliliters, February 2029. Next up, we have insulin N, 12 units of that, going to be administered subcutaneously. So I have my insulin N and pH, 10 milliliters, so we have plenty here. It expires 2029. Insulin N, 10 milliliters, and expires. Cool. We got that there. And then finally, for a as-needed administration, we're going to be administering Proctitube. PPD, we're going to be administering 0.1 milliliters intradermally. And we have that here. So this is 1 milliliter, so we have plenty in the vial. And this expires February of 2029. Here, 1 mil. There's that. Perfect. So now that we are done here, we are going to be moving now to the nurse's station. And the first thing I'm going to do at the nurse's station is, again, verify the medications against the MAR. So the first thing is we have Practi-Amp, 2 milliliters. And at this time, I'm actually going to flick this, make sure all medication is in the ampule, not in the top portion. That's just going to save me, make my life easier. Next up, and I am confirming that's 2 milliliters of unexpired, and this expires February of 2029. Let's move next to the insulin R. This is insulin R, 10 milliliters, expires in February of 2029. Next up, we have our insulin N, 10 milliliters, and this expires in February of 2029. And then finally, the Practitube PPD, which is 1 milliliter here. We're administering 0.1, so we have plenty. And this expires February of 2029. So we are all set. Medications are verified, and now we can begin to administer. So the first thing, let's go ahead and do the Practi-Amp. So to do that, what we're going to do is I'm going to get my needles ready, or my tubes ready, syringes ready. So we have our syringe here, and we're going to be using a 3 milliliter syringe because we are administering 1.7 milliliters. I'm also going to get a filter straw ready to go. And finally, we have a 22 gauge, 1.5 inch needle here, which is perfect for an intramuscular injection. So the first thing I'm going to do is I'm going to take a alcohol swab, tear this, throw it away, and then I'm going to use the alcohol swab to place over the ampule, and I'm going to break away from me. Just doing one final check. Perfect. We're going to dispose of the top of the ampule in the sharps container, and then the medication or the pad goes into the trash. And then I'm going to take the syringe and affix the filter straw. Via lure lock. And then I'm going to carefully not touching the sides of the filter straw to the sides of the ampule, I'm going to insert. And I'm going to draw up. And in order to make sure we are getting enough medication, I'm going to draw past the 1.7 line. And we can just waste it. Perfect. Now that we have this, we can remove the filter straw. I'm gonna take this, I'm gonna throw this in the trash, and then I'm going to affix the 1.5 inch 22 gauge needle. And now I'm going to push excess medication in order to get to the proper administration amount of 1.7. So there's 1.9, 1.8, and 1.7 as I'm dripping. And then I'm going to take this, put it back inside its syringe holder, and I'm going to, using the triangle method, mark the medication. And I'm going to use plenty because my handwriting is bad if it's small, and I need to be able to read this. So we are going to be administering Practiamp. 1.7 milliliter. We are administering this intramuscularly, and this expires in February of 2029. And then I'm going to take this, and being careful to not block my line so that I can read the medication, I'm going to affix this label as straight as I can. And Practiamp, 1.7 milliliter intramuscularly, expiring February of 2029. So now that that's prepared, I can move on to the insulin, and I'm gonna I'm gonna place this back into the syringe wrapper, and I'm gonna throw this away. Next up, I'm going to prepare the insulin. So for that, we're gonna work on the order of, first, I'm going to roll the vials, allowing us to mix the medications without creating excess air bubbles. So we're gonna do that, make it nice and pretty, mixed up together. And then the next thing we're going to do, as you probably just saw me touch the top of that, I'm going to take an alcohol wipe and I'm going to sterilize the top of these. We would do it for 30 seconds. And so I've done this for 30 seconds, and then I'm going to do this for 30 seconds with another one, but in an effort to save materials, using the same wipe, but I would use a different wipe in a hospital setting. And then I'm going to dispose of this in the trash. And then what I'm going to do is, going from cloudy to clear and then clear to cloudy, I'm going to take the needle. Well, I'm first going to drop 20 units of air. I'm going to remove the syringe from the cap, and I'm going to first push cloudy, And I'm going to push this down to the 8 line because we are administering 12 units of the insulin and the cloudy insulin. So this is going to push air to 8. And then we're going to push the remaining 8 units of air into the regular. And then while we're here, I'm just going to flip this bad boy around, and we're going to draw up 8 units of clear regular insulin. And then we're going to re-inject it into the insulin N, and we're going to draw up 12 units. Making 20 units of insulin. All right, and I'm going to level this back out. I'm going to withdraw this, and then carefully, not touching, I'm going to insert the needle into the cap, and then once it's at a safe distance, click it in. And I'm going to set that inside the syringe wrapper while I prepare the label in the triangle method. And here I have insulin R 8 units. We're going to give this subcutaneously, and this expires 02 of 2029. And then we are also giving insulin N, NPH 12 units. Subcutaneously, and this also expires February of 2029. How convenient. And then I'm going to affix the label to the syringe, and just like with the intramuscular injection, I'm going to do my best to not block out the lines to make sure that we can read this. Label really quick because I don't like that. It's going to stick and cause problems. Or I'm just going to tear it off. Okay, that works. Let's do that. So we have insulin R 8 units subcutaneous, February 2029, and then insulin N 12 units subcutaneous, February 2029. And then that was, just to show again, 20 units total. And I'm gonna place this back inside the wrapper to bring back to the patient's room. And then finally, I'm gonna prep the as needed dose of the Practi-2. The ampule can go from earlier, can go into the Sharps container, and I am placing the medications to go back to the Pyxis. And then let's go ahead and grab another alcohol swab. I'm going to roll this medication, just because. And then I'm going to take an alcohol swab, and again, swab for 30 seconds. 1, 2, 3, 30. This gets tossed. And then we are administering 0.1 milliliters. So what we're going to do is, using the tuberculin syringe, we are going to pull to 0.1 air. We're going to uncap. We're going to insert the needle, inject the air, flip it, and pull. 2, Just trying to get the air bubbles out. And it's good. Okay, so I'm gonna flip this back around. I'm gonna withdraw this needle, and then I'm going to carefully, without touching the lid until the needle's completely covered, cap this and place it back inside the syringe wrapper so I can create my label with the triangle method. And then here we are administering Practitube PPD. This is being injected intradermally, and it is 0.1 milliliters. And this expires in January of 2020, or February of 2029. It's Practitube PPD being administered intradermally, 0.1 milliliters, February 2029 is expiration, and this massive tag is gonna go on this tiny needle. Like so. So we have our Practitube PPD intradermal, 0.1 milliliters, expires 2029. I'm gonna place this back in here. The medication is gonna go back to the Pyxis. And now that we are all set here, I'm going to go to the patient's room. So, boom, patient's room. I'm outside the door. Hi there, my name is Zach. I'm gonna be your student nurse today. I'm gonna be helping out with administering your medications. First things first, can I just have you confirm your name and date of birth, comparing against the armband? So, name, Manny Stickens, date of birth, 12/15XX, and then I'm just confirming the MRN matches, 73421. And then I just want to confirm, do you have any allergies? All right, perfect. So you do have an allergy to penicillin, and I am confirming that that is recorded in your medical record. So we are all set there. So the first thing that we're gonna do, I'm gonna perform hand hygiene. And I'm gonna don some gloves. And then I'm gonna verify the medications and give them to you. Manny. Perfect. So the first thing that we're going to administer is going to be the Practi-Amp, and then I'm going to verify that against the MAR. These won't be all sticky together. I'll have these separated in a tray. So we have Practi-Amp, 1.7 milliliters, injected intramuscularly, and the medication has not expired yet. So what I'm going to do is, using the landmarks, oh, and then let's just go ahead and verify them all while I'm here. So we also have the insulin R, 8 units subcutaneously. And this is not expired, this expires February 2029. And then insulin N, 12 units being administered subcutaneously. This expires February of 2029, so that one's fine. And then the Practitube, this is Practitube PPD, It's being administered intradermally, 0.1 milliliters, and this expires February 2029. So now that all medications have been verified, let's go ahead and administer the Practi-Amp. So we're going to administer this into your right ventrogluteal. So using the landmarks, I'm going to identify the patient's right ventrogluteal. I'm going to take the syringe, and this will be at a 90-degree angle. So I'm going to uncap. I'm going to pull the skin tight, insert, and inject. Oh, and before injecting, I would aspirate to make sure that I'm not in a blood vessel, and then I'm going to inject. So now that that's complete, I'm gonna take this using the table to I'm not gonna recap this because it is dirty. So I'm going to just place this in the sharps container. Next up, we have the insulin. This will be administered subcutaneously, so 45 to 90 degrees. We're gonna go ahead and do the pinch test. I can pinch an inch, so we are going to administer at a 90-degree angle. So I'm going to uncap this. I'm going to pinch that inch. I'm going to insert the needle and push the 20 units. I'm gonna withdraw. Place this in sharps, and then I'm using a cloth, applying pressure but not massaging, and I would do that for the intramuscular as well. I'm gonna put pressure, I'm not gonna massage the medications in. And then finally, and I would use a fresh rag every time, or a fresh cotton or Q-tip or cotton ball every time. And then finally we're gonna be doing and I did not clarify, the insulin would be injected into the abdomen. I'm gonna say right abdomen, 2 inches away from the umbilicus. And then we're gonna administer the Practi tube. This will be administered in the, let's go ahead and do left forearm for this one. And we're going to do it in the ventral portion of the left forearm. This will be administered at between a 5 and a 15-degree angle. With this, we're going to insert the needle bevel side up, pulling the skin tight, and the hallmark sign for this, we're going to insert it about 1/8 of an inch in, and we're going to inject, make sure we see a bleb, and then we're going to withdraw the needle and apply pressure, have the patient help us if needed, and then we're going to dispose of the needle into the sharps container. After completing all of these, I'm going to assess patient safety, make sure the bed is lowered to proper height, make sure guardrails are up, make sure they have access to call light. Manny, is there anything else that I can help you with? Any questions that I can answer? No, great, thank you so much. And now I'm going to verify the details on the MAR, so I can take my gloves off, and we're just gonna throw that into the trash. And then we're going to line through the administration time. So we did complete the 0900 administration of Practi-Amp, 1.7 milliliters. And I'm going to document the site that was injected into the right ventrogluteal. And then I'm going to give them my initials. Next up, we did the insulin R and the insulin N, both of which were administered into the right lower abdomen, right lower abdomen, right lower abdomen, and I'm going to initial. And then finally, we have the Practi tube, and that was administered into the, and I said left arm this time. And we did complete this at 0900 and initial. And then I'm going to sign off. Zach Smithley. SNSCC, student nurse, and initial here. And we're all set.